Hello and welcome to the third Bristol University Press webinar. This is part of a series of webinars that we're holding during these extraordinary times to look at key issues arising from the pandemic, focusing on areas where learning from events and evidence could create positive social change. I'm Catherine King, Marketing Manager, and I'll be hosting the webinar. I'll be taking your questions to ask Sam at the end, so please use the Q&A function at the bottom of your screen. If you have any technical issues, please use the chat function and someone will help you. I'm delighted to introduce Sam Ren Lewis, author of our book, The Happiness Problem, which was published last November. Sam is an independent scholar, a wellbeing consultant, and former head of research and development at Happy City. What have been the major impacts of COVID-19 and lockdown on people's mental health? And how can individuals build back their lives in ways that are more meaningful than before? The pandemic is an opportunity for societies to build back better rather than return to business as usual. Sam will discuss whether we can do the same on an individual level. After that, there'll be time for questions. I'm now going to hand over to Sam.
Great. Thank you, Catherine. So as Catherine mentioned in her little description there, there have been these general calls for not just things going back to normal post lockdown after the crisis has dissipated somewhat, but to build back better. So to deliberately build an economy that is resilient to shocks like pandemics in the future, but also other potential shocks of climate change and deals with issues of inequality, not just providing people with jobs, but with well-paid and meaningful jobs in green technologies and so on. I'm not going to talk about that. I'm going to use that as a kind of beginning to think about what building back better would look like in terms of people's mental health, and not just for the economy, but obviously during these past few months, people's well-being and mental well-being have taken a serious hit. And instead of just going back to normal, what would it be like to build back better, both on a social level, but also what can individuals do, as Catherine said, to build back their mental health better from this time. And so just before beginning to talk about that in more detail, I want to be clear that for people who have lost their jobs or are struggling to look after their kids or are socially isolated, clearly the return back to normal is the priority, right? That's the first thing to do. I'm not denying that. What I want to explore in this webinar is just in addition to returning people back to their prior standard of living, whether we can do more for people's health and well-being. So to explore this, I want to draw upon a distinction that I think is really useful when thinking about our well-being, that I discuss at length in my book, The Happiness Problem, Expecting Better in an Uncertain World. And that is drawing on an array of empirical research from neuroscience, cognitive science, computer science, anthropology, sociology, which looks into how humans, but also almost every mammal, has these two fundamental capacities, psychological capacities, for control on the one hand, and for connection on the other. And I'll just briefly explain what I mean by that before looking at the COVID crisis and lockdown in particular. So our capacities for control are all about sorting the world into good things and bad things, or rights and wrongs, or shoulds and shouldn'ts. So using all the knowledge we have, all the things we've learned, to effectively get as many of the good things as possible and avoid as many of the bad things as possible. So that's quite simple, and we use very sophisticated capacities on top of this, like goal setting, planning, the building of routines, habit forming, all ways in which we can efficiently achieve our desired outcomes, and like I say, get stuff, or have stuff, or keep hold of stuff in order to improve our lives. So that's control. And on the other hand, we have our capacities for connection, which are really designed for the opposite situation. So it's, whereas control is all about everything we already know, and the ways in which we can change the world accordingly. Connection, I'm using in a bit more of a nuanced way. So I'm not talking about our relationships necessarily with our friends, family, loved ones, and so on. I'm using the term connection more in the sense of our connection with reality, our contact with the world. So these are our capacities to pay attention to what we don't know, to gain insight into the unknown. So to have a relationship with uncertainty, where we can reveal new truths about ourselves, about others, about our surroundings, and therefore be able to respond more flexibly and fluently to reality. So there are kind of states like wonder and awe and curiosity and interest, all designed to kind of open us up to what we don't know and to understand our lives on a deeper level. So bear that distinction in mind as we kind of go forth, and hopefully that will make sense in terms of this topic later on. So I want to look at control first. So from the mindset of control, from the mindset of stuff we have, stuff we're trying to get to improve our lives, I think it's quite clear that the coronavirus epidemic and lockdown have been a disaster for most people, and for people's mental health in particular. We don't, as far as I know, and I'd be very interested to hear more from anyone listening on this, we don't have a massive amount of data yet on the impacts of the past few months on people's mental health. We know in the UK that people's subjective well-being really plummeted in April, and I think that continued in May. I'm not too sure, and obviously we don't know the lasting impacts that this crisis will have on people's subjective well-being and mental health. So we don't necessarily have that, but what we do have is I think a lot of research on the factors that really impact our well-being, and I think there are three very clear factors that have been at play during this crisis, which I'll talk about in turn. So the first one is loss. So quite clearly, people have lost loved ones during the coronavirus pandemic, and that has a huge impact on people's happiness and health. The other thing that many people have lost is their livelihoods, and both bereavement and unemployment are probably the two main factors that have a lasting impact on people's subjective well-being. So many factors have a negative impact on people's well-being, but only for a temporary period, for around sort of 6 months to 2 years, whereas the corrosive effects of unemployment and bereavement can be much longer. So that's clearly a devastating shock for many people and their mental well-being. The second thing is social isolation. So, clearly many people have had much more isolation than they are used to, much more than is healthy. We now know that social isolation and loneliness has a extremely negative impact on both our physical and mental health. So loneliness has similar impacts to smoking, if not much worse, in terms of our health and life expectancy. And this is obviously much worse for elderly individuals over the past few months, and vulnerable people who have had to be shielding during this time. So clearly, again, very negative well-being impacts for those groups. And then the third thing that I want to look at is people's sense of certainty and confidence and trust. So, it's become commonplace these days to say we live in uncertain times, and we almost kind of reel it off. But it actually has some quite profound implications on people's sense of control, sense of well-being. If before this crisis, you were under the illusion that we lived in a relatively stable and secure society where we were steadily making progress, or indeed in our own lives, that we had our life plan and our goals, and we were steadily working our way towards them, that has been obviously shattered this year. The fragility of society in our lives has been laid bare. Something that happened halfway across the world has impacted globally in a matter of months, and will continue to do so for the foreseeable future. So that underlying sense of knowing what's going on, of being able to make sense of the world, of being able to trust the systems we live in on a local and national level, is hugely important to people's well-being again. So we should expect there to be a very sort of negative impact again on people's mental health as a result. So I see these as the kind of three most damaging impacts of COVID-19 on people's mental health and lockdown. And what I wanted to spend the rest of our time talking about is not just how we can return to normal, but again, how we can build back better in response to each of these three factors. So again, sticking within this control mindset, this idea of having and getting stuff in our lives, what can we do to mitigate these three negative impacts that we've witnessed? Starting with loss. So obviously, we cannot return back to normal if we've lost a loved one, but there is a considerable amount of research into what we can do for people suffering from bereavement and grief, social support at work, time off work, and access to therapy being the main things there. And in a way, there is now the opportunity to have much more of a culture, much more of a sensitivity around that support, and the fact that needs to be provided. In terms of loss of livelihoods, obviously opportunities for re-employment, potentially for retraining, and income support in the meantime are necessary. So I think in a way that's quite straightforward, how to mitigate for loss that people have experienced over this time. I think the other two factors of social isolation and uncertainty are a bit more, I don't know if radical is the right word, but potentially progressive on a social level, and actually feeding very well to the general Build Back Better movement, which is looking at how we can build back to accommodate for issues of social justice and environmental justice. So when we look at social isolation over the past few months, we have seen a glimpse of how we could build back better. So we've had this kind of wartime blitz-like spirit of communities coming together, especially to help elderly and vulnerable households through informal grassroots volunteering and action. And we know that happens. There's again quite good research on this. When disasters strike, it's surprising how much it doesn't result in a kind of individualistic chaos, but actually this opportunities for community organizing and altruism come together. What we also know, though, is that they tend to be short-lived once the crisis is over. In order to sustain what we have seen over the past few months, there does need to be investment on a local community level. There needs to be investment in community decision making, the ability for communities to make decisions, to start initiatives, for public spaces where people can meet, for community organizers to connect different people together, for things like social prescription from GPs and the health service and so on. So I think that's a really interesting potential avenue for building that better in terms of people's mental health that we've began to have a taste of over the past few months. And I think in terms of uncertainty, we've seen something similar again. The uncertainty that people have witnessed as a result of the crisis, I think has seen on a local level a return to localism. So things like people coming together and creating sharing economies, things like locally grown food networks, for example, changes in people's habits where instead of being part of very complex global systems, people have gone to look at how they can potentially exist within a more local level and a more resilient system in that way. And on a national level, we, again, similar proposals have been brought forward in the agenda, things like a universal basic income, which has suddenly risen in popularity as a way in which people will not necessarily have the uncertainty in terms of their employment and income, and if this happens again in the future. And social movements like Black Lives Matter really rallying around, not wanting the future to, again, if shocks happen, for the negative impacts to be always brought upon the already disadvantaged members of society. So I think there are ways in which, in terms of the more uncertain, less trustful conditions we have now, we can build back better in response. So to finish, because I want to leave as much time for questions as possible. So far, I've just looked at what we would do to build back better people's mental health from a control mindset, things that people have and can get in their lives. And I want to just briefly mention at the end this other capacity, this other fundamental capacity we have for connection, from being in contact for the world with to understand things on a deeper level. And I actually think we've seen, again, many ways in which this crisis we can respond to it in a way that actually can improve our lives going forward. And to kind of look through each of the factors we looked at already, again, from this different mindset, I think is interesting. So we've looked at loss already, and there are things we can do, things we can have in order to mitigate the negative impacts of loss. But I think it's useful to understand, and again, there are it's large empirical literature on grief and crisis, and how for some people, not everyone, far from it, over time, and the length of time is very varying, grief can be a process in which major new insights can occur, and it can be a real catalyst for people to reassess what's really important in their lives, what really matters to them moving forward, and how to spend the rest of their days. And that can be really quite profound. And the same for loss of livelihoods. Any major life crisis, whether that be a midlife crisis or a mental breakdown, can have this impact for people. Social isolation, again, for many people it's not chosen, but we do have a term for a more voluntary form of social isolation, which is solitude. And I think even in some languages that don't have this, I think German being one, the sort of translation for solitude is to connect with self, a connection with self and one's surroundings. And so again, I think that this period, the lockdown period, can be, I'm not saying it's not bad from all the ways we just discussed, but it can also, in addition, be an opportunity for people to understand their own bodies, their own company at a greater depth, to not have the same distractions, pressures, conformity of normal social life, things like FOMO, and really reconnect with who they are, what they care about, and their surroundings, most notably their homes. And third and finally, uncertainty. Our capacities for connection are all about uncertainty. They're all about what we don't know about reality. They're all about what we yet to understand about the world, and opening ourselves up to that uncertainty. And so I think, just to end, I think this whole crisis in general has had incredibly devastating effects for people, and we need to make sure to build back better in the ways I've suggested for people's mental health. And I think from a connection mindset, from a mindset of understanding, the uncertainty that we've all experienced as a result can be a profound opportunity to take a step back, if you're able to slow down, and to reflect on the things that really matter, and individually understand how to build back better. So that is it. I would love to hear your questions, and thank you very much for listening.
Thank you very much, Sam. That was really interesting, very positive way of trying to think about how we can build back better. I have got a few questions that have come in, but please do add any more questions that you'd like to the question and answer function at the bottom of the screen. So I'll just take the first question that's come in. It says, sorry, and there's something else just popped in. With regard to the impact of social isolation, does the research differentiate between introverts and extroverts? As a shielded introvert whose disability means that exclusion and isolation is the norm, I haven't related to the stereotypical view of social isolation as being onerous and harmful at all. Introvert bliss, they say.
Yeah, great. I don't think the research does actually distinguish between introverts and extroverts. I would like to know if anyone has read anything that does, but no, there's this kind of assumption, and I guess it does kind of depend on what you're measuring when you measure social isolation, but there is an assumption that in general, humans need some kind of contact, similar on a biological level, almost to how we need food or shelter. We need some kind of social contact. And I think the way in which introverts and extroverts differ is largely around how that contact is provided. So that might be a very distant form of contact, if that's not too much of a contradiction in terms, through connecting through Zoom or phone or whatever, or it might be a much more closer one, a much more doing exciting activities, like you sort of stereotypical of an extrovert. So yes, I do agree that I'm sure this experience of lockdown has been very different between introverts and extroverts. I personally identify with being an introvert, and I've enjoyed the extra space and being able to do my own thing. But I think on a more fundamental level, the idea is that social contact is basic in some respects for everyone.
Yeah, great. I have questions coming in thick and fast now, so I'm going to need to go quickly. Alessandro Sicora has said from Trieste in Italy, says, thank you for the webinar and thank you for your book. His question is more on your book, if possible. It's about the connection between happiness and shame. When reading the first pages of the book, you describe one of two forms of books on happiness as presenting lists of things to achieve, lists of items that you think you need to be okay to fight for. My mind registered a connection between this and the concept of shame. That is the feeling of not being enough. And I started thinking about the many books of having lists of your personality characteristics that you think need to be okay. What do you think about the connection between these two concepts? Could you find any connection in your presentation today?
Wow, that's a wonderful and massive question. Thank you. Yeah, that notion of good enough, I think, is really interesting. So I've spoken, and this can be explored at much greater length, but this distinction between control. We have these capacities for control, which are all about getting stuff and having stuff. It's all about more, all about ways in which we can improve our lives by having or getting more things. And I don't mean they're just material stuff, you know, like a bigger car or a house or whatever. I mean, potentially loving relationships, potentially a healthy family or a safe home and so on. And then we have this other capacity for connection, which is much more about not necessarily getting or having anything, but being open to new understandings, to new insights, and participating in that uncertainty of life. And I think the idea of good enough opens up when we start to explore these capacities for connection, because in a way, we're never good enough. From a point of view of the control mindset, we can always have more. We are inherently insecure in our lives. We can always do more things in order to be safer, to be more secure, to be better off. And I think it's only really when we start to take everything we don't know seriously, everything that we are able to see the value in what we already have, in order to see the value in every human being, and so on, and being able to see that maybe to some extent our lives are good enough, that people are good enough. And so I think it's really through embracing this connection mode of being that we can begin to have a much healthier relationship with whether things can be improved or if they're good enough, and things like shame. That only just touches upon your question.
Yes, I'm sure there's a lot more that we could explore with that. This is a much shorter question. Do you think that the uncertainty we're living at the moment will help us learn to be happier in the future?
Yeah, that's a really great question. I don't know. It's a bit of a cop-out, but I guess, so there are two. So I do think that in order to be happier, we need to have we need to have a much healthier relationship with uncertainty. And I do think we live in a very control-based society where our relationship with uncertainty is actually quite unhealthy. We always want to know what's going on. We always want to be right. We always want to get all the things that we think are good, rather than have a bit more reflection and understanding on what actually might be good for us, or what might be the underlying causes of our problems and so on. So I do think we need to open ourselves up to uncertainty more. And there is a large amount of research, as I say, that shows that crises and events where suddenly things do become uncertain can be the catalyst for that, can be an opportunity for people to embrace what they don't know, and to open themselves up to a larger, bigger picture of reality. It can do the opposite though. So it can be such a shock that people, instead of kind of being blasted open, have to retreat even further and grab hold of the stuff they already have, or stuff they can get in even more kind of desperate fashion. And so which one happens? I think there are factors that tell. So for example, what everyone else is doing can be really important. So if there is a general kind of, again, this kind of like, wartime spirit where everyone is dealing with uncertainty, everyone is coming through with new insights and new understandings of what really matter, that can be extremely powerful. And yeah, my hope is that this crisis can have, as Catherine was saying, that positive effect in the long run if people are together in this.
Absolutely. I think we've got time for maybe 2 more questions. So the first one I've got, it says, you mentioned the elderly and vulnerable people, but what are some specific ways in which social inequality affects the ways we experience happiness?
Social inequality in general experiences happiness. Yeah, it's another big one. I mean, it's tricky. I think in general, inequality is terrible for happiness. It's one of the worst things. But it does also depend on how you look at happiness. So I think, again, from a control perspective, from that mindset we have where life is about what we have and what we can get, inequality is perhaps the worst possible thing. It restricts access to all the ways in which we can improve our lives, and it makes everything we already have much more insecure and much more vulnerable. And I guess the reason I hesitated is because I want to constantly reaffirm that this is not the only mode of existence we have. This is not the only capacities we have for dealing with the world, which is just getting and having stuff. We also have these abilities to pay attention to our lives and to understand them more fully and to react in a much more responsive way. Now, the less we have, the more insecure our lives are, the less we can actually do this. So, I'm not making any excuses here, but there is still the fact that all our lives are insecure, all our lives are uncertain. And in that respect, we can all find some ways of being happy in that more connecting, being in touch with reality sense, no matter what position we're in.
Yeah. And finally, looking to the future, in a year's time, what would you like to see fundamentally change in how society operates and what we do differently? That's a big question.
Yeah, why not end on that one? Yeah. That's a great question. So I think one of the main things that came through when writing my book, which for me was an interest that really started on an individual level, like about 10 years ago when I started doing a PhD in happiness and subjective well-being, really became, I became much more interested on how this plays out on a social level. And in particular, again, this idea that we live predominantly in a society that cares about control, cares about improving everything. So having the right relationships, having the right kind of work, having the right kind of politicians, policies, and so on. There's nothing wrong with that. But what gets lost, if that's the entire focus, is if we only look at the short-term outcomes of what will make things better, we lose the longer term process, which obviously in the long run, the quality of the process is way more important than whatever we do in the next 1 year or 5 years. And we have some huge problems ahead of us: climate change, technological unemployment, just to mention a couple. So I would like to see, as this is off the top of my head, but I'm confident in this being my main desire for society in a year's time, that we have taken this crisis to heart, that we're not going to get to some kind of social utopia anytime soon, that life is inherently insecure, and that what we really need is a process that can be open to stuff we don't yet understand. So on a social level, this might be looking at methods like deliberative democracy to solve problems, even though they're much more uncertain. Nonetheless, having more viewpoints in the room. In terms of education, that might be educating children to be curious rather than just pass exams, and so on. There's all sorts of other implications that I write about in the book, but in general, caring more about the process of how we do things on a social level rather than the immediate outcomes, I think cannot be underestimated.
Thank you ever so much, and I'm sorry to everyone we haven't had a chance to ask questions, ask your questions. I'm sure Sam would be happy to take them by email, and we could possibly, possibly, if that's okay with you. So thank you very much for joining us today at this Bristol University Press webinar, and also to our speakers, Sam Wren-Lewis. The Happiness Problem is available as a print and ebook at 20% discount from our website, bristoluniversitypress.co.uk, or 35% discount if you sign up to our mailing list. Our next webinar will be on the 16th of July with Jeremy Williams, who is co-author of The Economics of Arrival. Please see our social media or website for further details. Thank you very much for joining us today.
Thanks all.